Hey there, and welcome back to the Health and Safety Podcast, your weekly guide to healthy aging and living your best life, one smart step at a time. I'm Michael.
And I'm Eric.
And today we're diving into a topic that often gets overlooked, but has a huge impact on your overall health, oral health.
Yeah, that's right. Your mouth says a lot about your body. And in today's episode, we're going to talk about why taking care of your teeth, gums, and mouth is just as important as watching your blood pressure or getting your vaccines.
So let's dig into Smile Strong, why oral health matters more than you think. We tend to think of oral health as just brushing your teeth, right? But there's so much more to it. Did you know that poor oral health has been linked to heart disease, diabetes, and even Alzheimer's disease?
I didn't know that. Your mouth is like a window into your body. If there's inflammation in your gums, there may be inflammation in other parts of your body too.
Yeah, for older adults, common issues like gum disease, dry mouth, and tooth loss can seriously affect quality of life.
Yeah.
They can make eating difficult, lead to infections, and even affect speech and self-confidence.
So here's the big picture, y'all. Good oral health is about more than just your smile. It helps you eat well, speak clearly, avoid pain, and stay healthy from the inside out.
Let's talk about what tends to pop up with age and how to stay ahead of it. Number 1, gum disease, periodontitis, caused by plaque buildup and poor brushing habits. It can lead to red, swollen, or bleeding gums and eventually tooth loss. It's not a normal part of aging, and it's preventable.
Yeah, that's a common one too. You hear that, and
Yes.
they have a lot of toothpaste that will help you with that right now. The second one is dry mouth. It's often caused by medications. Saliva is important. It washes away bacteria and protects your teeth. Dry mouth increases your risk of cavities and infection.
Yeah, and if there's saliva, keep it in your mouth.
How about that part?
There
How
you
about
go.
that part?
Number 3, tooth loss and ill-fitting dentures. Missing teeth can affect chewing, digestion, and nutrition. Dentures need to fit well and be cleaned daily. Otherwise, they get all dirty and filled with bacteria, and that can probably more than likely lead to problems with oral health for sure.
Yeah, the dentures need to be taken just as well as you taken care of as well as you take care of your teeth, right? So it's not it's a substitute for your chewing and biting, but it still needs that care.
Yeah.
And fourth is oral cancer. More common in people over 60 though, but regular dental visits can help catch it early. So look for any sore or lump in your mouth that doesn't heal in 2 weeks.
Yeah, good information. All right, here are some simple steps you can take right now to protect your oral health. First, brush twice a day with fluoride toothpaste. Very important, and I follow that to the T, definitely.
And fluoride's pretty good. I like fluoride. Floss daily. Yes, even if you hate it, and I used to hate flossing, or use a water flosser. But as I got older, that became a regular part of my routine, especially the water flosser now. It makes it a lot easier.
Yeah, the water flossing I like better because you don't have to, you don't cut the circulation off your fingers. So you use,
And I got tight teeth, so Michael, you laughing at my pain?
I got tight teeth.
I do.
Eric who? The guy with the tight teeth.
That's how you describe America. That's how y'all describing me.
He can't
whistle.
whistle.
That's that podcaster with the tight teeth.
Terrible whistler. Whistler. All right, next, visit your dentist at least once a year, more often if needed.
Yeah, and at least once, y'all, because again, we're talking about preventive, and then you can do it twice a year. That's even better. The other one is drink plenty of water to fight dry mouth. Drink plenty of water.
Definitely. And drinking water here in the desert, that's a big issue. So drinking water, period, is just going to be helpful.
Yeah, absolutely. Yeah. Absolutely.
If you wear dentures, clean them daily and take them out at night.
So there's people who actually keep them on 24 hours, huh?
I can imagine that now.
Yeah. Limit sugary foods and drinks, especially sticky snacks. So limit that.
Okay. All right, talk to your doctor or pharmacist if you notice dry mouth. It might be related to a medication, and if it's been a while since your last dental checkup, no shame. Life gets busy, but this is your reminder. It's time.
Yeah, it's
Right on.
time.
Definitely.
That's what this is about. Again, Preventive. I love when we get together, Michael, because we are trying to help y'all. And when you hear our future podcast, we had an amazing day today on the outside streets, and we'll talk more about that later.
Yeah.
But we realize that people do really care. And as me and Michael come every week to bring you these podcasts, we really care about you as well. So if you could take any of these tips and move forward, that'd be awesome. Quiz time. Tooth Truths.
I like that. There we go. All right, let's see how much you know with this week's quiz. Tooth Truths.
Yay.
I'll ask 5 questions, then we'll give you the answers.
Yes.
All right, so question number 1. Are you ready?
Yes.
How often should older adults visit the dentist? Click, clock, click, clock.
Goes
click,
the clock.
click. What do you guys think? And the answer is at least once a year and ideally every 6 months.
Yeah, ideally every 6 months. I was thinking that as well. Yeah. All right, number 2. What's one common cause of dry mouth in older adults? If you guess medications, you're correct, especially for blood pressure or depression. So just keep an eye out for that. If you have dry mouth, drink more water.
I thought it was talking too much, but
For me, it is, Michael. I've been guilty. You got me.
Number 3, true or false? Gum disease is a normal part of aging.
What?
Click.
A normal part.
Click. The answer is false. It's common but not normal, and it can be prevented.
Number 4, which health condition is linked to poor oral health? Is it arthritis, diabetes, eczema? Well, the biggest answer is diabetes. Diabetes is the main one linked to oral health too. Wow.
All right, what's one thing you can do at home to improve oral health today? All right, what can you do today? Think about it. If you're listening to this, what can you do to improve your oral health today? All right, answer: brush, floss, stay hydrated, or rinse your dentures. Definitely.
And I'm glad we're on this topic. As we get older, and this is just maybe speculation, but it seems like, these are things we don't really think that's important, but they are. Your oral health is important. And again, it boosts your confidence. And if anything can be preventive so it doesn't get worse, that's what it's about.
We don't, it seems like I've never have, and I think most people, I might be speaking for a lot of people here, I think we don't associate oral health with disease.
No, we don't.
We think about our teeth, and it's just mainly for, showing off. We're showing people we eat with our teeth, we chew with our teeth, these are things that people can see. Right. But I think people don't, Yeah,
and again, you're speaking about even some basic things like our speech, right?
Yeah.
Without proper gum, with proper teeth or oral health, your speech is affected.
Yeah.
And so that could affect your confidence. So it's little things to big things here. So and this month is all about our older adults. So if you're listening to this and you're not one of the older adults, and you see somebody in your family that could use some additional information on oral care, pay attention to that, assist them, offer them some resources, and of course, let them listen to this podcast.
Yeah, for sure. All right.
Now it's your turn. This week's mission: pick one oral health habit to focus on.
Yeah, maybe it's flossing again, drinking more water, or finally booking that dentist appointment. Even one small step can lead to a healthier, happier you.
And if you wear dentures, check that they're fitting comfortably and clean. If something doesn't feel right, reach out to your dentist.
And your smile is worth protecting, and so is your health.
Well, thanks for joining us on this episode of the Health and Safety Podcast. If you learned something today or something new today, share this episode with a friend, and don't forget to subscribe to us so you can catch every new episode that we put out.
Yeah, you can find us at iHeartRadio and Apple Podcast, and you can also go to our website and choose the podcast tab. So check us out at CPR4AZ.com/podcast. That's CPR4AZ.com/podcast.
Yeah. Next week, we'll wrap up our 4-part health series and with an energetic look at staying active as you age, how to move more, feel better, and boost your strength and independence.
All right, until then, keep smiling
Stay healthy
and stay safe.